Looks great. You're nice and
Okay.
aligned. What size valve is this?
56.
56.
Were it still repositionable at this stage?
Okay.
No. Well, that it is
Positionable. We can tilt it.
tilt it slightly, right? And make some minor movements, Nicolas. You can't recapture. The minute the anchors come out, you can't recapture. But you lose the repositioning as you get bigger and bigger. So at this stage, like Philipp said, most you can do is maybe slightly tilt it if you need to bring an anchor one side slightly higher, slightly lower in relation to the annulus.
And at full ventricular expansion, you're already interacting with all the anatomies, so it'd be even hard to do that, right?
Ought to be released now. There you go. There you go.